So they got concerned and bring the cat to the vet immediately. So I want you to think about which cat do you think has the worst welfare? Cat A, cat B, or if you think the welfare is the same? Let me pull out the poll. A, B, or C? Some of you may have, if you have listened to me before, you may have listened to this question before. But that's all right. It's always good to remind ourselves what is welfare and what is ethics. Okay, so we have 15 answers right now. So a lot of you think, well, we have a range of different answers right now, but that's all okay. Next slide will show the answer. So when we talk about animal welfare science, what we're actually doing is we're looking at welfare from the animal's point of view. So that's when we need to measure how the animal is feeling. And when we actually take everything else out of consideration except for how the animal is feeling, then you will see that animal welfare science actually just tells us from the animal's point of view how the animal is feeling. Therefore, the welfare of both cat A and cat B is actually the same. The same in the sense that they are feeling the same amount of pain, probably amount of suffering, probably amount of distress is roughly the same. Because when it's presented to you and you look at your assessment of the cat, it has similar types of injury and wound. But the difference is in how the people, the owner, treats the cats. Now that falls under ethics. So animal ethics actually is all about how humans treat animals. So this is the easiest and one of the clearest way I can describe to you the difference between animal welfare and animal ethics. So every time that people talk about animal welfare, especially if they use the word science, animal welfare science, we are looking at from the animal's point of view. And if we talk about ethics, we're always concerned about what the humans think, whether it's right or wrong. I hope that is going to be clear because the rest of the the rest of the presentation, I'll be talking all about ethics. Now, just to recap a little bit from last webinar that we did a month ago, we talked all about welfare. Now, welfare, as I've mentioned before, we are concerned about how the animal is feeling. And the animal can feel from on one hand very negative experiences and on the other hand very positive experiences. Sometimes it's not just about making sure the animal is not undergoing pain or stress, because if you take away the negative experiences, like for example hunger, pain, or fear, you have a neutral animal. You take away the negative, you have something that is neutral. It doesn't mean that the animal is enjoying its life. The animal has a life worth living. It's not what we are calling it. So you can see here in the middle. But it doesn't mean that an animal is having a good life or having positive experiences. So welfare is both about not having that negative experience, but also how do we make it more pleasurable, more positive for the animals in terms of how it has these types of experiences. Okay, so I think you can imagine yourself as well. If you are bored, let's say, if you take away that boredom, it doesn't mean that you're actually experiencing pleasure. So how do we actually bring welfare to above? So the thing that we need to understand is welfare is not just about relief of suffering, but it's also about how much pleasure the animal experiences. And it's all about from the animal's point of view. So in the clinic setting, the last webinar, we've talked about how we can improve welfare of that animal in the clinic settings. And in summary, we're looking at these 5 different animal welfare needs. So the need to have a suitable environment, the need to have a suitable diet, the need to be protected from pain, suffering, injury, and disease, need to be housed with or apart from other animals, the need to be able to exhibit normal behavior patterns. So I know a lot of us who works in the clinic, we are very, very focused on this animal welfare need, the need to be protected from pain, suffering, injury, and disease. But really, we need to think about a more wholesome way of what animal welfare is, and we need to keep on thinking about these other needs as well. So just remember the 5 animal welfare needs. And if you Google it up, you come up with a list. So if you don't remember it all, there's always Google. But what I'm going to talk more and we're going to discuss today is all about ethics. And I have mentioned earlier on, ethics is all about humans' perception of what is right and what is wrong, what we should be doing, what other people should be doing. There are many different kinds of ethics. We have professional ethics. So if you are a vet working in a vet clinic, I'm sure you have your veterinary council or veterinary board who regulates all the vets in your country, and they will come up with the guidelines in terms of what is professional ethics, what you should be doing and what you cannot do. You also have societal ethics. So this is what society expects from you. If you grow up in different areas, different societies, you will have slightly different expectations as well. So that's societal ethics. And then each of us will have our own personal ethics. And our personal ethics can be very different, even though we might, have the same experiences, have the same background, but what we find as our personal values can be very different from one another. Now, what we're going to talk about is more specifically animal ethics, which basically looks at how humans view our obligation towards animals, or how we view people, how we view about what we think about use of animals. It also will differ according to your situation, your expectations, your background. It will differ from for different animals. It will differ for, if you reevaluate yourself over time, it can change. So nothing is always set in stone. And why do people have different animal ethics? Well, the major thing is that it differs from one individual to another is because there's no consensus, global consensus towards how we view animals, towards what is an animal's value and what is the moral status of animals in our society. Now, I can talk about this all day long, but just to summarize it up, there are 4 different ethical points of view that is related with a veterinary practice. First is what we call a contractarian view, which means that animals only matter indirectly to the extent that humans care about them. Basically, it says that an animal is not a thinking being, and therefore it cannot come into contract with us. But what we are concerned about is how we treat the animals belonging to other people. So it matters indirect. Animals matters indirectly because we are concerned about how society thinks we treat animals, or for example, how the animal's owner thinks about us, how it affects the animal's owner if we are cruel to the animals, for example. Or in your country, you might have laws related to how people treat animals. So you are treating the animals not because you care for the animals, but because you care about how other people perceive you. So that's contractarian view. The other view is called utilitarianism, which is also widely known as the animal welfare point of view. So I think that's one of the reasons why animal ethics and animal welfare is confused, because of the term welfare has been used in various contexts. But in the welfare or utilitarianism point of view, we are looking at the consequences of using animals and how it benefits the animals or the people who's using those animals. So, for example, using animals for food. We know that it benefits people by giving us protein, but at the same time, we need to look at welfare from the animal's point of view. How can we maximize welfare for both the user of these animals and also the animals itself? So one of the things that is acceptable when we eat animals is that we need to make sure that the rearing of these animals and the slaughter of these animals is as minimal suffering as can be. So that's utilitarianism. Now, the other point of view, the ontological point of view, or animal rights point of view, is people who think that it's more than just consequences of our actions that matters. We need to care about the animals because each of these animals has their own value. So people who are in this, who have this ethical view, are usually called animal rights because they one of the priority is to respect that animals themselves have rights. So therefore, we it's not easy to justify our use of animals. For example, where utilitarianism point of view says it's okay to use animals for food, those with an animal rights point of view think that it's not okay to use animals as food because we can get our protein and our source of energy from plant-based materials. The last ethical view that is related to animal practice is contextual or relational point of view. Now, this considers more than just respecting animals' rights. It takes into consideration our emotional bond with that animal, and how humans perceive ourselves as well as being virtuous. So in our own values, we need to be kind and compassionate, for example, or especially if we have a bond with the animals like our pets, then our commitment to our own animal is especially more than animals that we don't own. So it all relates to the human animal bond or the relationship between animals and humans. So if you think about why people argue about animals, a lot of time it boils down to people having different sets of values. So, for example, a contractarian view versus an animal rights view will be different from each other, and it's hard for them to reach a if they very strongly feel against about what they hold as true, then it's hard for them to come to terms with each other. So you have a lot of arguments about it. So we need to really understand when people are arguing what ethical point of view they have. Now, we don't necessarily have only one point of view. We might have a mixture of all of this. So I've put in this link here at the bottom. If you can click on it, and at the end of the slide, I'll put the link there again. If you can click on it, it'll bring you to a website where you can test yourself and understand yourself better in terms of where you stand with animal ethics, and which ethical point of view you stand in. You can also read a little bit more additional about each of these point of view. So it's not just the point of view that we're talking about when we talk about ethical dilemmas that you face in the practice. Let's say that you need to treat an animal, or an animal is presented to you, and you need to decide what to do with that animal. You need to consider things like from the vet's point of view, but you also need to reconsider things from the pet owner's point of view in terms of what they want for their animal. After all, it is their animal. But you also need to consider a few other things like your boss point of view, or if it's not your boss, let's say you own the practice, then you need to consider about your livelihood and how that practice is going to earn some money. So you can't, just leave out the kindness of your heart and live on sunshine and water all the time. We need to have our living as well. And lastly, we also need to we need to consider societal impact and societal point of view and societal expectations. And this could also mean um, like our own colleagues, so our profession with veterinarians or vet nurses. We need to consider public safety, public health. So a few other things that we need to consider as well. So it's not so simple as just treating an animal. So this unfortunately is one of the things that we face in the veterinary practice. We have different expectations and different obligation to all the different partners. So here's an example of a dilemma, which is neutering. So if you want to get a cat neutered, for example, and you know that the benefits will be, of course, they have no more kittens, and that would help in terms of the stray animal population. But they also will get some health and behavioral benefits as well. So in terms of benefits, you have on one hand, but on the other hand, there's also the risk as well, and there's also pain and distress that the animal can go through during the process of neutering. So how do you balance out the benefits and the risk of neutering? So a few things of these kind of things we need to consider when we are faced with a dilemma of what to do with an animal. Now, this example that I'm giving you here is actually quite an easy example. I think a lot of you already don't even think of this as a dilemma. But there's many other things in practice that you have or may encounter in your work. So maybe you can describe now some of the dilemmas that you face in your practice. So have you faced a dilemma at work? And if you have, describe one or two of them. And if you don't work in a vet practice, you can think of what kind of ethical dilemmas you face in your own work. It might be not related to animals at all, but it's still an ethical dilemma in terms of your obligation to fulfill with many different parties. So it seems like a lot of you have faced ethical dilemmas in your in your work. Whether one of the examples here is whether to neuter pregnant animals, that's a very good dilemma, and it is relevant in so many Asian countries. I work mostly in Asian countries, so I know what the situation is like in Asian countries. I can't say the same for other countries outside of Asia. Okay, and if any of you have other dilemmas, please type it down. I will proceed with some of the other examples, but if you type down some of the dilemmas, then at the end of the webinar, we can go back and discuss some of them. Okay, we have a few more. Euthanasia, and relocation of wild animals. That's yeah, it's a dilemma as well. So here are a list of some possible ethical dilemmas that you might face in practice. Things like cancer surgery and chemotherapy for very old animals. So is it justified to put that animal through so much stress just for it to live a couple of more weeks longer? Low income patients who cannot afford treatment, and I think one of you, Miriam, has also identified that owner not willing to pay for treatment, so cannot proceed. Same again, patient suffering, but owner can't afford surgery and don't want to euthanize on religious beliefs. Yes. Kidney transplant as well. I think maybe not so much in where my country in Malaysia. I've never heard of any vets doing this, but I have heard of vets in other countries doing kidney transplants. Now, one of the dilemma would be, where do you get your transplantation, your extra organs from? Sale of unnecessary products and services. Trap neuter release for stray animals, especially if it's done in a place where there's poor veterinary standards, or especially if it's done in a place where society itself doesn't want those stray animals around. So is it ethical to do it? Euthanasia. A lot of you have already identified euthanasia. Breeding of animals. Um, Cosmetic surgeries such as tail docking, ear cropping. There's even debarking for dogs, so that it doesn't take away the vocal cords so they cannot make noise. All this can be an ethical dilemma. How animals are trained, whether it's an indoor or outdoor cat. And some of you have also identified some very interesting dilemmas as well. Vegetarian cat, I think that's a very good thing, a very good ethical dilemma. Vegetarian dogs and cats. Helping tortoises cross the road. Do they actually want to cross the road? That's the dilemma. Ooh, rabbit blood transfusion. Donor needs to be sedated to take blood. Cloning of an animal. Oh yeah, all these are very, very good. Abandoned cases, especially I think if you're working in practice, you might have people abandoning animals at your practice itself. What do you do with it? How often do you think you encounter dilemmas in your practice? Depopulation of healthy poultry, or depopulation of healthy dogs and cats as well, especially if it's in a stray control program. It happens in a lot of places, or even in shelters as well, especially if the shelters are full. What do? You have to sometimes they think that they have to depopulate healthy animals. Yep. So owner wants to euthanize pets because they're relocating overseas and can't afford shipping. These are all what we call convenience euthanasia. So it's euthanasia because it's more convenient for the owner or for humans. So yeah, we have a few range, but it looks like you have an ethical dilemma at least once a week, maybe even a few times a week. And I think that's true for a lot of us in practice. Actually, it's true for a lot of us vets, whether in practice or not. Uh, Yeah, it happens everywhere. Ooh, use of lab animals in lab demonstration, especially for teaching. Yes, right. Very good. Sorry, very good examples. So now, how do we approach an ethical dilemma? There are decision frameworks that we can use to help us think a little bit more logically, and actually basically what it says is to sit down and think about all the different ways, all the different um, factors that could help or impact our decision on a dilemma. So 6 point decision framework. First is to establish interests of affected parties. Second, to identify the issues involved. Then next is to identify the different possible courses of action and looking at the consequences of each action to choose the most logical course of action. And six is to minimize the impact of the decision. So I'll be talking about it one by one. First is to establish interests of the affected parties, and these may include the animal itself. We must always think about that. We must look at what the owners want. We must look at it from a veterinary point of view, and this is basically of a more scientific understanding of what the animal needs. We need to think about our boss, who we answer to, or the business. We need to think about the veterinary profession. We need to think about the society. And society can mean other humans or other animals out there. So earlier on, when we discussed about different ethical views, some of these may take place here in terms of where the owners stand, where you personally stand, and what your colleagues or your boss or your business stands as well. So it can help you to make the right decision, or at least to discuss it openly with the different stakeholders that's involved. And if you can't come to a mutual conclusion, then at least you can understand your differences, where you're coming from. Now, one of the things that's special about the veterinary practice is there is something called the veterinary dilemma, because veterinarians have to serve both the patients and the owners as well. And our patients are voiceless patients, so we need to put ourselves in their shoes in terms of what we think the animal really needs, and what the animal really needs can conflict with what the owner wants as well. Your responsibility is not necessarily to always follow what the client wishes blindly, but you have also another obligation, which is to safeguard welfare and to maintain public trust in your profession. And you need to also understand the difference between what is your responsibility and what is the client's or the pet owner's responsibility. Now, it's very easy to say you want to take over the responsibility and make the decision for them, but is that sustainable? Second step is to identify the issues that are involved. So we must consider it from the different aspects. The two most important aspects to identify is what are the welfare concerns and what are the actual ethical issues that's involved. So earlier on, when I described the difference between welfare and ethics, this is where we need to put that knowledge in place. So when you face an issue, we must understand what the welfare is. So what does the animal um, point of view is, what is the animal feeling, and at the same time we need to think about what is the ethical issue that we are going to discuss, that we need to decide on. Other issues that we need to think about, for example, is legal issues, um, societal or cultural issues, or even religious issues. And a lot of times it's not just one issue, it could be multiple different issues affecting the problems, the dilemma that you see. So maybe it's not just one welfare issue or one ethical issue, it could be several welfare and several ethical issues all at the same time. So from there, we have the setting of your problem, and now we need to move on to thinking about what we can do. So a lot of times, here is the time to list down all your possible courses of action and maybe prioritize them in terms of what is the best outcome for, best decision that fits what everybody wants. Now, in terms of veterinary practice, options can include things like not doing anything or no treatment at all, giving palliative treatment, that is to relieve the suffering of that animal, or you can actually do active treatment where what the animal actually needs to cure it, to treat whatever diseases that the animal have, or to put the animal through further diagnosis so that you can actually be a bit more targeted in terms of how you treat the animals, or refer it out. So this is where you need to acknowledge your limitation of your knowledge and skills and ability in your own veterinary setting, and be brave enough to say when you need to refer the animal to another practice. And the last option is euthanasia. That is also an option. Next is we need to think about what is the consequences of each action. And if we're talking about the animals, it's very important to understand what the welfare concerns are and what the ethical concerns are. So, for example, if you're going to do euthanasia, normally the welfare concerns is less because euthanasia is relieving the animal from further suffering. But there's a lot of ethical concerns when it comes to euthanasia. So you need to think about what are the consequences for both welfare concerns and ethical concerns. And then fifth is when you actually choose a logical cause and understanding all the ethical theories and using them to support your action can actually help you as well in terms of reducing the bias attitudes towards the animal. It can enable the right decisions to be made rather than relying on what is common practice in your area. And it can give you a bit more confidence in your decisions. So you have your ethical theory to support and to back up why you decide to do what you do. So this last thing is to minimize the impact of the decision. This is often termed refinement, especially if you're working with lab animals. You know the three R's. Refinement basically means that how are you going to reduce the harm produced by that decision for the animals and also for the people and other stakeholders involved. So, for example, if you decide to neuter an animal, so and the example that I gave earlier, to neuter an animal, we know that neutering itself can put the animal through pain and through some distress. So we can decide to minimize the pain by giving it good pain management, medication, and minimize the distress by handling that animal well, make sure that the recovery and where the animal is kept is done in a very good and safe environment for that animal. So it's if you, once you make a decision, we need to think about how we can reduce the harm to that animals. Use of princ- use the principles of medical ethics can also help as well. So if you're veterinary, you might be um, you might have heard about the medical ethics, so non-maleficence, beneficence, the theory of first do no harm, and also justice, and also um, letting your patients decide for themselves. So the four different medical principles of ethics. You can also set boundaries to help you in your decision. So first of all, you have to respect the client's autonomy. So the client has the right to make his or her own decisions. You should not omit or bias the information that you provide, or use guilt to persuade that owner, to do what you want. You can also have policies in your practice. So if you have policies, for example, if you say your practice doesn't do cosmetic surgeries for animals such as tail dockings or ear croppings, and you don't dispense drug without seeing the animals first. So these are some hospital policies that will help you relieve your burden of making that decision every time it comes about. So having the hospital policies does help. So do you have policies in your practice? Okay, so we have a couple of people who have answered, and it looks like most of you have at least some sort of practice policies, and that's actually very good news for me because it'll help you to relieve the burden of making that decision. So again, to recap the decision framework, first is to look at the interest of all the affected parties. Next is to identify the issues that are involved. Next is to identify the possible causes of action, and then to look at the consequences of each action, and then to choose the most logical course of action. And the last one is to minimize the impact of that decision. So I have one case that I've prepared, so we can go through it very quickly. So a zoonotic disease case. So a cat was presented to a clinic, and then it was diagnosed as having sporotrichosis. So it's sporotrichosis is a fungal disease that is zoonotic. That means it can transmit to not only other animals but humans as well, and it can be very difficult and take a very long time to treat. Now, the owner who brought this cat in have a baby and have two other very young children in their house. This cat is what we call a free roaming cat, so it has access to outdoors at all times, so it can mix with other animals and it can mix with other humans that live around the neighborhood. The owner wants to treat the cat and is willing to pay for the treatment, but they cannot confine the cat during the treatment, so the cat will remain a free roaming cat, and they also don't want to euthanize the cat. So, in terms of our 6 steps, first we need to think about what are the interests of all the affected parties. So, the animal, of course, you can see the animal is suffering, and the first priority for the animal is actually to relieve it from suffering. This relief can be either in the form of euthanasia, or it can be a form of treating the animal for that disease that it has. Vets point of view is to make sure that the animal is treated or at least relieve it from its suffering. And also, we need to minimize the risk to other people or to other animals. What the owner wants is to treat the animal, and the owner does not want to euthanize the animal. And in terms of the public here as well, public needs to be protected from zoonotic diseases. And it's not just talking about humans, public also means other cats and dogs and other animals in that area. So, what are the issues that are involved? In terms of the welfare issues, when we look at the cat's condition, we are sure that the cat is currently suffering from that disease. So it doesn't have that freedom from injury, pain, and suffering and disease, but also that animal is suffering some sort of distress as well. And what are the ethical issues that are involved? There is the potential zoonotic risk to other humans and animals. And there's the ethical issues about the acceptance of euthanasia. Are there any legal issues involved? Well, in Malaysia, there is no legal issues. It comes with sporotrichosis. But cultural and there are cultural or societal sensitivity around euthanasia. It's not to say don't want euthanasia at all, but people are sensitive about it. And the third is to identify the possible causes of actions. Now here, from the background, I've boiled it down to three different possible action. First is to keep the animal in the practice and then to treat the animal in the clinic itself. Second is to encourage the owner to confine the animals at home and then to treat the animals. And the third one is euthanasia. So we identify the consequences of each action. So we need to think about welfare consequence and also the ethical consequence. So if we go with number one, welfare concern would be the animal can heal, yes, but the long duration of treatment is not really suitable for it because it will be confined to a very small space during that months. So it's not really good for that animal. And what is the ethical concern? Well, if you're concerned about zoonosis and spreading to other people, at least in a clinic setting, we can prevent this from happening. Now, what about action number two? Well, the welfare, again, because it's treated, the animal can heal, but and although it is confined, the cat is still in the home environment, so it has bigger space to go about. We can think about enrichment in terms of confining the animals in the house. We can think of enrichment to minimize the consequence of that, and at least the cat is still at home as well. It's where it's familiar. But the ethics is that the cat is still at risk of spreading it to the children and the humans at home. Now, the third course of action would be, if we look at it from the welfare perspective, animal can be relieved of its suffering. So it's not a welfare. I mean, euthanasia is not so much a welfare concern because actually it's a benefit for its welfare, but it's more towards an ethical concern because the owner can feel strongly against euthanasia. So, what did we do? What happened was we actually discussed all the options and we including the cost and how much commitment it takes to treat the animal. We discussed it all with the owners and we discussed lots of euthanasia as well. We discussed the owner's perception about euthanasia and we found out that the owner was initially reluctant because there was societal um, input about euthanasia and how sensitive people are, and because people think that euthanasia is actually a cruel thing to do for the animal. But after explanation and after explaining to them that euthanasia is not necessarily cruel, but it helps them to relieve their suffering, they finally accepted it that it was the best option for the cat, the family, and also for public safety. So that's what we went for. The final option is euthanasia. So what did we do to minimize the impact of this action? This one we need to be concerned about how the owner take euthanasia. So we gave them time to say goodbye to their cat. We did the euthanasia with the owners present in the room so that they can see that the cat is not suffering through the procedure. So that's it. Does anybody have a particular case that they want to discuss? Or else we can actually take some of the cases that were mentioned above. So what we'll do is maybe the first case we'll talk about the neutering of pregnant animals. So here we have the decision framework that could help us think about that. So the first one is, who are the affected parties? We know that the animal is one of it, and there are risks involved uh, in terms of neutering the animals, so higher risk than normal neutering. So higher possibility of suffering. We also have the animal owners, so what they think about terminating uh, neonatal animals. We also have the the vets, so that's you, or vet nurse, or your staff basically, who what and how they feel about terminating a pregnancy. So we need to think about where each of us stand. Now, some I know in Asia, even with in vet practices, um, a lot of us, a lot of vets are also influenced by their religious background, and some vets feel that um, their religion says no to euthanasia. So therefore, in their practice, they have a policy where they don't euthanize or they don't neuter pregnant animals. So what are the potential issues that are involved? If we look at the welfare issue, um, we need to think about whether there is an overpopulation of animals in that area, and whether actually terminating the pregnancy um, helps to reduce the number of stray animals on the road, or if those cats or dogs, kittens, and puppies have a good home to go to. So we need to think about the welfare of not just the mother animals, but also the consequences of what happens to the puppies or kittens after they are born. The ethical issue here is, of course, termination of life, and where do people think life begin, whether it's at what stage of pregnancy is considered life. So these are two main issues I think that's involved. And the possible causes of action is basically to neuter or not to neuter. If you neuter, you can terminate the pregnancy immediately, and we don't have the burden of dealing with the kittens and puppies. Or do we want to wait for the animals to give birth, and therefore we need to think about the consequences of how we deal with the babies that are being born and whether they get good homes. um, if there's a huge overpopulation, if shelters are full, how are we actually going to guarantee good homes for these animals? Or if we terminate them early, then we at least we give chance to animals in those shelters to get good homes, and or animals that are already born. So we stop it at the root cause. Now, the other possible consequences for the action would be the ethical concerns. So we need to think about what the owner wants. We need to think about how society judge us. There are different countries where um, people are more towards animal rights, so they feel that animal has the right to live, and therefore um, euthanasia is not necessarily acceptable. So in those cases, you might have, I mean, the best course of choice might be to let the animals give birth first. So from there, we need to think about the logical course of action and then minimize the impact of the decision. That is making sure, if you're going to do the termination, then making sure that the animals get proper pain medication, gets proper care after the surgeries. Or if you're going to let the animals give birth, then we need to think about rehoming the animals, or how we're going to ensure that all these animals have good homes and not put extra burden onto the stray population. So maybe I'll have a show of hands in terms of neutering pregnant animals. Uh, Maybe raise your hand if you will neuter a pregnant animal. So me personally, I will. Oh, I'll raise my hand. And I will do it even if it's in late stage pregnancies, because I do work in a shelter and I've seen the consequences of animals being born. So we do have a few people who agrees to terminating a pregnant animal. Um, Vegetarian cat, I have the next thing on my list, so we can discuss about that. How do we decide? If people come to us and asking us maybe a diet plan for a vegetarian animal, so we need to think about the interest of all the infected parties. The animal, of course, they want to live a good and healthy life. Maybe the pet owners themselves are vegetarian and they have a very strong ethical belief in vegetarianism. Um, yep, identify issues involved would be welfare issue of the animal. Can a cat or dog live a healthy life under a vegetarian diet? So a lot of vets, uh, I know we learn that cats are obligate carnivores and therefore they need animal meat proteins to live. Otherwise, they get um, malnutrition in terms of certain components of their diets. But dogs, it's possible. Some vets are saying it's possible for cats now, even, but I haven't looked at it properly. So that's one potential welfare issue, which is malnutrition. In terms of ethical issues, would be, if what does the owner think about feeding the cat meat or dog meat, especially if they strongly believe in terms of not using animals. Um, Identify the possible causes of action. So there are a few things that we can do here. We can advise the owners in terms of what is the right thing to do. We can try to search for information in terms of how do we balance the diet of a vegetarian cat or dog, or we can refer them out to a nutritionist so that they get better advice from for to plan the nutrition of the cat. Yeah, those are the things that I can think of right now. Identify the consequences of each action. So again, looking at the welfare. Um, so again, this comes to with number 6 as well, overlaps in terms of how do we make sure the animal is not malnourished and it gets all the nutrition it needs. So yeah, that's it. I mean, one of the possible causes of action here as well can include giving the animal up for adoption and choosing a vegetarian animal. So maybe they can rear sheep or goats. um, yeah. Any of you have a better idea, better solution? So anyway, I hope that this decision framework could help you to identify the different issues, to look at how people think about the different dilemmas, the different ethical issues, how we need to differentiate between what is the welfare concerns and ethical concerns. And then from there, we can boil down our choices and hopefully it will minimize the impact of our choices. And if we don't have any particular welfare issues that we want to discuss, then I will end the discussion right now by giving you the summary. So remember that ethics concerns how humans should treat animal, while welfare means how we measure the animals, how they are feeling from the animal's point of view. Personal or animal ethics can differ for each of us, and it can also differ in terms of the different situations that we are in. So we might have one stand today, but things might change tomorrow. Having a framework can be useful in terms of approaching an ethical dilemma. So that example I'm giving you is one example of a framework that you can use. And lastly, of course, continuously educate yourself and your team. Think of um, learn more about animal ethics, learn more about how people perceive different things, and hopefully by continuously discussing with everybody, even if you disagree with them, it will give you more ideas to think of solutions outside the box. So that's all I have for today. And the last thing I wanted to say was I'm going to leave you with this link here again so that you can actually go and test yourself in terms of where you stand, and you can actually measure your progress throughout time. So you can do this again every year, for example, to see whether you have changed your opinions or not. I know personally when I do it, I change all the time. Um, that's it. If anybody have extra time or anything, I mean, we have extra time if we want to. I know time is up. We said 1 hour. But if you have any additional ethical dilemma that you want to discuss, I'll be happy to do it.
Thank you very much, Natasha. We still have a few more minutes for questions. And if you like, I'd like to invite you to turn on your microphone if you feel better to be voiced as opposed to type. I understand this is it can be very emotive and it can be very mind-boggling. So perhaps speaking might be easier. If you'd like to talk to us, please unmute your microphone and then go ahead and ask the question. I'd just like to start, Natasha, with a very sort of simple question. It's very interesting, and thank you for taking us through the decision framework. And it's very nice in this controlled environment and where we can sort of have time to reflect and discuss and verbalize. I wondered, in your experience, which step did you find the most difficult? And bearing in mind that people have different personal perspectives and ethical points of views.
It's a very, very good question. I think that the most difficult thing is to identify the issues that's involved. A lot of people tend to mix up welfare and ethics, and therefore the solutions that people propose can be quite confusing for a lot of people. So, for example, decide to euthanize an animal that has poor prognosis in terms of treatment or sickness. Um, People think that euthanasia is a very cruel thing to do. So if you look at it, if you mix that welfare and ethics and you think that euthanasia itself is cruel, you take that solution out of the framework. So therefore, it's hard for you to actually make a decision what else you can do for that animal. So sometimes by removing a good possible solution, your only leftover possible course of action, is all quite bad welfare for the animal. So trying to take yourself out of your shoes, out of your own personal bias, your own personal how is it that ethical point of view, and putting yourself in other people's point of view, other people's shoes, can also be another difficult thing to do. These are two things I think would be key. So the first and second points are a bit more difficult to do. But a lot of times it is normally with practice. Practice means that you discuss it. Either you discuss it with your colleagues, your staff, or you can discuss it with your clients. And through the discussions, it will help you to understand people's motivation better. It will help you to understand what are your options as well. So the more you discuss, the more you understand ethics. Ethics for me initially when I'm learning it, it was very difficult because it was a bit more philosophical. But the more I discuss, the more I read up about it, the more I feel a bit more comfortable tackling ethical issues.
Thank you very much, Natasha. Could I invite the audience if they have questions that they'd like to?
Type out your questions as well.
I think, Natasha, are you receiving any questions at your end?
No, we have one question. So we have a very good question here. The Natalie Mauro have asked, do you have any recommendations on how to deal with having to do something that goes against your personal ethics? Yes, I mean, I face that a lot of times as well. And sometimes what our scientific training also can go against what our personal ethics or how we grow up believing in things as well. I think we need to always reflect on ourselves in terms of where we stand. I think the more we learn about things, the more we understand things, the more our perception can change. And we need to understand that our perception is not set in stone and it can change. And we need to identify when we change it, and we need to, embrace the change. But if we are not, I mean, if we don't change, and if we have people who don't necessarily agree with what our personal ethics are, but maybe we have come to a decision that that is the best decision for that animal. So one of the things you can personally do is either that you accept that this is the best outcome based on what everybody wants, and you can find a way to just do it even though it goes against your personal ethics, um and keep on telling yourself that that is actually the best outcome, even though it is a very difficult thing for us to do. The other thing that we can do is we'll always have colleagues, we'll always have other staff, we always have other vets around us, so we can refer the action to someone else to do it. So if you are really uncomfortable, for example, with neutering pregnant animals, or if you're really uncomfortable with euthanasia, then say that. I mean, like, acknowledge that it is very difficult for you to do it. Explain it to the owner that it's against your own personal ethics, even though you decide that that's maybe the best course of action for that animal, and say that you personally will not do it. So you'll need to find colleagues, you'll need to find other people that can do it. So refer them out. I think that's my recommendation of how to deal with it. So there's another question, another good question. So my dilemma is about knowing cruel acts being done to animals by people that I know, but I'm afraid to talk to them about it and complain to authorities or to file a case based on the anti-cruelty law. Uh yes, I can see where you are. It's a very difficult thing to tell on other people. I think this is maybe an Asian quality as well, where people prefer to keep quiet than to actually voice out and point out the wrong of other people. So I think that is one of our maybe our societal ethics in influencing us in our decision in doing that. But I think we need to judge in terms of how what is the welfare of that animal and the consequences of us not doing any action. If it's a minor thing that you think will not repeat again, that maybe is something that we can oversee, that's okay. But if something that will make you feel guilty and you know that something can affect the animal highly, then we need to think about something that we can do about it. So there might be, if there's an animal cruelty law in your place, there might be an organization that could help with finding cases. There might be some way of uh, reporting that anonymously, or there might be ways to educate the people that dropping hints, giving leaflets, or bringing up a completely different subject but related subject, and talking to them about it. So one of the one of the things, I don't know whether you know or not, but people find that there's a link between animal cruelty and domestic abuse. And oftentimes it starts with animal cruelty in the house, before they start abusing either the wife or the children, or people in the family. And a lot of times it's a very difficult subject to talk, especially if kids are being abused and they don't want to talk about themselves being abused. But talking about animal cruelty actually helps open them up to talking about their own abuse. So again, related subjects, both are difficult matters, but one area might be easier to talk to them and open people up to discussion. Hopefully that helps. Next question. Question I have: it is discussed that we should include the welfare of animals, views from vets and owners into our consideration, but I wonder whether we should also include environmental costs to the consideration in the future, as the One Health idea seems to be becoming more important these days. Um, I completely agree. Yes, you are right. I am very focused in terms of the impact of animals here, but the One Health approach, and soon you will start hearing about the One Welfare approach as well. So there are some of the actions that have impact on environmental cost as well. Things like, for example, if we are well, this happens in some countries where mass poisoning of dogs and cats happen because they want to control the stray population. When they take and bury the carcasses near the rivers, they find that they're actually polluting the rivers. So it does have an environmental impact as well in terms of how we treat animals. Another example of environmental impact uh, is is maybe cats that are allowed to roam outside the house, and they actually kill quite a lot of wildlife, even though we don't see it. So these are some suggestions in terms of how ethical dilemmas can overlap with environmental costs as well. And yes, agree with you that it should be considered.
I think, Natasha, I think it's been a really good discussion, both when you went through the cases and also here now with these questions. Should we wrap this session up, or has anybody would like to raise one last question? Otherwise, we'll wrap the session up. Okay, I think it's been as you said, Natasha. It's ethics is it's philosophical, and I think it will take us some time, many of us, to go home and think about what you've said, and really go through those steps and reflect on past cases that we've had, experiences that we have, and practice within ourselves those steps. So I'd like to thank you very, very much for this webinar session. It's been really insightful and thought-provoking, and also we hope you'll have you back here again in this webinar platform. So thank you, Natasha. Before we end and say good night or good morning, possibly, if you're somewhere sort of further west to Hong Kong, I'd like to just let you know again, remind you that we have recorded these 2 webinar sessions, and we'll make these recordings available for you to review and listen back as soon as we can, and we'll be sending you an email to let you know how to access the recordings. Also, we'll be uploading the PowerPoints in PDF format of these 2 presentations. Again, we'll notify you by email. Also, I'd like to invite you to visit us here at this link. We have a lot of great CPE events, workshops lined up, particularly for those of you who work in veterinary practice, like veterinarians, vet techs, nurses, and animal keepers and trainers. So please visit us at this link and see if there are workshops or seminars that you would like to join. Once again, I'd like to thank our sponsor, Royal Canin, for their generous sponsorship of this animal welfare webinar series. And of course, thank you all for joining. I know it is a somewhat later night for many of us, and we'll hope to see you again at our future CPE events. Thank you and have a good night.